Hello, everyone. Welcome to today's Breastfeeding Q&A webinar. We're so glad to have you here with us. Joining us today are Dr. Manisha Gogri and Charmi Gala to clear all your doubts around breastfeeding. Dr. Manisha Gogri, MBBS, IBCLC, is an international board certified lactation consultant and runs the Fit for Birth Lactation Clinic in Mumbai. She has helped hundreds of parents and babies navigate simple to complex breastfeeding issues. She is also a trained childbirth educator and has served as a La Leche League leader. She regularly trains doctors and nurses in lactation management and is associated with various national and international breastfeeding organizations. And Charmi Gala is the head nutritionist and a lifestyle expert from Team Lok. She leads the pregnancy, Sattvic, cleanse, and rejuvenation verticals. We request you to drop any questions you have in the Q&A box, and they will be answered in today's session. And with that, I hand over this webinar to Charmi. Charmi, please go ahead.
Thank you very much for this warm welcome. So, I wanted to specify specifically breastfeeding because it's one of, is the more breastfeeding is more than a nourishment. It's comfort, protection, and connection for both mothers and the baby. And with this, it helps to build up strong immune system, proper gut development, brain development, and also lowers the risk of any chronic illnesses or allergies for both mother and the baby. And in fact, it also helps in aiding the hormonal balance with the mother's health, and it also connects with the mother in terms of emotional health. So every feed, I always feel it's a it's a care, compassion, and the bond between mother and the baby. So with this, breastfeeding as important for baby's life, which is definitely going to give a lifelong, I think, best of his or her health. With this, breastfeeding also come with a lot of challenges, and today I'm here to make aware what are the challenges which mothers can come across and how we can deal with it, so that we can in case if any of the mother is using formula milk or any top milk, we can reduce and still have a chance to breastfeed the baby and develop that bond. So let's begin. So Dr. Manisha, I have the first question for you. Most of our mothers want to exclusively breastfeed, but in many cases, they say that they do not get enough milk for first few days. Or especially, this question comes from C-section mother that, oh, I have undergone C-section, but my milk supply is very low. So I want to understand your perspective in this, why all these things happen, why, initially first few days mothers have very less milk, and especially for C-section, how does it work?
Sure. Thanks, Chami, and good afternoon to you all. So, see, this is a commonly asked question that all of us lactation professionals always get. When women come to our clinic with a lactation issue and we take a history, they said, they always say in the first 2 days, no, doctor, I didn't get any milk. First 2 days, you're not supposed to get any milk anyways. So, I think this is the biggest misconception. What the milk that you get in the first 2 to 3 days is a very highly specialized type of milk, which is known as colostrum. And it comes in very, very small quantities. Like, sometimes you may just see drops, which are golden yellow in color, liquidy, and they don't look like milk at all. The expectation is that white milk, you don't see that. But actually, if you analyze, this is like the first vaccine of the baby, as every drop contains thousands and thousands of antibodies, live cells, immune factors. So this first milk, even though it comes in drops in small quantities, is very precious. It is enough to satisfy the needs of the baby, because a baby who is put to breast frequently, immediately after birth, starting within the first hour of birth, and then, almost every 1.5, 2 hourly, 10 to 12 times a day, this baby manages to get the colostrum that he or she needs. that is enough to satisfy the needs of the baby and is also actually priming the gut. We talk a lot about gut health, right? So the gut immunity, what is the foundation of that? That is this colostrum, correct? And the misconception for C-section moms is also the same. Why I feel more in case of C-section moms, we don't get, the colostrum also sometimes comes in late is because of mother-baby separation. So the mothers and the babies need to be together. Skin to skin contact is what we recommend immediately after birth, whether the baby is born via C-section or of course, in a normal birth also, the baby should be kept on the bare chest of the mother, skin to skin, which helps the release of the hormones, oxytocin, the bonding hormone, and the prolactin, which is the milk making hormone. And these hormones are the ones which are actually going to signal the mother's body to start making milk. Now, if this is not done in a C-section, yes, there are going to be delays. Plus, another common reason for delay in milk coming in the first 2 days is the medical interventions that happen during birth. So the message that I want to give out is try and keep your birth as natural as possible with minimal intervention so that all different types of medications, don't have an effect on you and your baby. The baby is born alert, baby can start suckling, mother's milk can start flowing, and nature has this beautiful design already. All we have to do is not to disturb that design.
Yeah. Thanks for this wonderful insight. So I have come across in our practice also that mothers do tell I have problem in latching the baby. So I'm not able to latch properly. I have sore nipples. So what could be the reason for all this?
Sure. So, see, latching, as you understand, latching or attachment of the baby on the breast is a two-way process, right? It involves the mother and the baby. And it also involves a third thing, which is the dynamics between the two of them. Correct? So, if we see the factors related to the mother, okay, first of all, education and knowledge, very, very important. And the right time to seek that knowledge is in pregnancy, not after you have the baby. Okay? Because, see, that is just imagine the state of the mother who has just given birth. She's not in a frame of mind to listen to instructions and learn new things. But if during pregnancy she has taken the effort to, either read, attend antenatal sessions, try to see other mothers breastfeeding, she knows how the process works, how to hold the baby, how to attach the baby to the breast. What is the difference between a good latch and a bad latch or a not effective latch? How do I know that, okay, my latch doesn't look right? I should know, right? If I've just attached the baby somehow and the baby is sucking, that doesn't mean breastfeeding. Correct? The baby needs to have a deep attachment at the breast. The baby needs to gulp milk at the breast. So if she is not aware of all this, and the baby's latching shallow often gives rise to nipple pain. Correct? So, as I said, first factor, education. Second factor, still we are on the mother. So, mother related factors like what? Some mothers genuinely have flat or inverted nipples, which can sometimes cause difficulty, not always, but sometimes cause a little difficulty. So, when we see this or we know this during pregnancy, we can advise them in the sense that, if you encounter difficulties, please take help. Because most often, if it is a full term baby and a baby who's latching properly, even if the nipple is slightly fat, the baby is going to be able to get the milk out. But
Correct.
now let us come to the baby. If there are some problems from the baby's side also, let us assume that mother is holding properly, latching properly. Still, the baby is not able to get milk out. Why? Because the baby may have some oral issues, some health problems, which are not allowing the baby to attach properly. And in our context, if we see, mothers always blame themselves, right? It is like,
Yes.
I am not able to breastfeed. I am doing something wrong. But yes, there could be problems which are beyond your control. That is where, professionals, lactation professionals come in, and a trained staff, very important in the hospital, because not all staff gets training in lactation. So a trained doctors, trained nurses, they will be able to help you. A lactation person will be able to help you. But the point is, don't just accept that I'm getting pain while latching. No, not acceptable. That means something is wrong and you have to correct it.
So you mean to say pain while latching is something which we need to address, and yeah, so mother needs to speak out and definitely address this. And as you rightly said, that education during pregnancy is important for her to make, all the possibilities awareness, and which is going to help her to latch the baby properly, and which will reduce the any top milk or formula milk. So thank
Yes.
you for this insight. I hope whichever mothers are attending, they will be able to understand this and work towards this. So another questions for where in fact you must be also coming across is like mothers do complain that I breast for long hours, but still my baby is not satisfied. Hence, we see there is drop in the weight, and we, as doctor suggested, we had to start formula milk, and
Yes.
the combination of breast milk and the formula milk is going to help baby to put on weight, and there will be zero gut related issues, as because doctors do say very liberally that it's okay, you start with formula milk, you start with I don't want to name the brands, but there are very good brands available. But what I understand in our practice, mother's milk is mother's milk. It cannot be duplicate with the formula milk. So what are your insights on the same?
Correct. So as you rightly said, what you just described is called as exclusive breastfeeding, correct? And
Yeah.
when we talk of exclusive breastfeeding, it means what? There is lot of scientific evidence to tell us that we need to give the baby needs only mother's milk for the first 6 months of its life. And in fact, the baby is going to thrive the best on mother's milk rather than anything else because it is natural. It changes according to the needs of the baby. So one interesting fact that I want to share here is when a baby is directly breastfeeding, the baby's saliva enters through the nipple into the mother's blood circulation. So if the baby has any infection, those germs are then going to signal the mother's immune system to make antibodies against
Oh.
that infection. So specific it is that when my baby has a certain infection, I'm going to produce exactly specific antibodies to treat that infection or to fight that infection. Okay, so now just imagine no product in the world which is manufactured artificially is going to be able to do that. And and this is also my answer to the question that mothers often ask me about is it okay if I pump and give my milk? It is my milk only. So why should I directly breastfeed? I can give pumped milk. But there is a difference that communication between the mother's body and the baby's body is not directly happening. That bonding which happens because of skin to skin is not happening when you are only pumping. Correct? Yes, of course, sometimes it becomes inevitable. I'm not talking about that. But in a natural scenario, it is best to directly breastfeed. Correct? And you asked me, what did you ask me? Sorry, I lost track.
So, mothers do feel that the milk, whatever they
Not enough.
produce, is not enough. Yeah.
Yes. So why I talked about exclusive breastfeeding was when you are exclusively breastfeeding, that means if it is recommended, that means your body is capable of producing that much milk. But there have to be certain signals, right? Because low milk supply is a reality. We see it every day in our practice. So we have to just take a history why this mother landed up into low milk supply. Correct? So the ways to maintain milk supply are that I told you, skin to skin to stimulate your hormones and constant breastfeeding, like frequent breastfeeding. This is the way your milk supply will remain up. Second is emptying of the breast. Means what? It's not that I just put the baby to breast. The baby has to empty the breast each time because that signals my body to make more milk. Correct? Imagine
Yeah.
now I have patients who have twins. Okay. And both the babies are exclusively breastfeeding. That
Wow.
means that mother is producing double the milk than a
Correct.
mother of a single baby. That means what? Our body is capable of producing that much double milk. But how does my body know? Because two babies are constantly feeding, my body knows I have to produce double. Correct?
Mm.
So, which means that the best way to ensure your milk supply is feed the baby often, frequently, and make sure the baby empties the breast. Make sure the baby is latched properly to empty the breast. See that the baby is gulping. Don't just see that the baby is nibbling on the breast, but make sure that baby is transferring milk. Your breast should feel lighter at the end of the feed. So, all these are the signs. And another thing, suppose there is low milk supply, the medical history of the person is also important, because Charmi, today, on our platform, we see so many mothers who have like this metabolic syndrome also, correct?
Yes.
So
Okay.
there is, there are problems related to weight, related to polycystic ovarian syndrome, then
Mm.
related to diabetes, hypertension, hypothyroidism. So these are also the red flags for low milk supply. Means what? There is already a hormonal imbalance in your body, and that can also lead to genuine low milk supply.
Yeah. Okay. So, based on your answer, what I can come down to the point is, if baby is exclusively breastfed, the milk is going to be tailor-made. In case if any infection is there, the antibodies are going to produce. This is the biggest takeaway for me. Second important thing is, in case if any issue which mother does face, she needs to highlight, and it can be rectified if possible. And second thing, if there is any metabolic syndrome or anything, still we can focus and get mother to breastfeed completely. And most important is, mother need to know the sign of emptying the breast, where the body is going to produce good amount of milk for the next feed.
Yes.
Great takeaways. I hope all the mothers are learning here. So next question I want to ask you is, if I want to, give baby bottles, specific bottles, maybe in the night, so that my sleep is not disturbed. What are your thoughts on the same? Because I keep getting these questions.
Okay. So, see, again, bottle is something that is unnatural that we are going to introduce into the whole natural cycle of things, correct? Now, why would a mother think about introducing a bottle? Like, one reason that you cited is that, I will express my milk and somebody else can give it at night so that I can sleep. This is the
Hmm.
common, question that is asked to me. Now, that looks like an advantage, right? I will get to sleep and my baby can still get my breast milk via bottle.
Yeah,
I will,
because sleep is again one of the pillar which we
yes,
always focus that restful sleep is going to help your
correct.
body to recover faster. So
Exactly.
how do we coincide both the things?
Exactly. So, see, I totally agree. Sleep is important, but just think, millions and millions of years, over millions and millions of years, mothers have breastfed their babies day and night, correct? Even think about centuries ago when there was no formula available. The only food available for the baby was mother's milk. So, imagine the mothers would be feeding. So, this is how nature has designed it. So, does it mean that they would not be sleeping in the night? No. So nature again has a very beautiful design for this. And what it is when we breastfeed during the night, number one, the level of prolactin hormone, which is released, okay, is much higher in quantity. So that, in fact, night feedings are the best to maintain your milk supply. So we were talking about milk supply earlier. If you are feeding during the night also 2 to 3 hourly in the early days and later maybe 4 hourly or whatever, the prolactin is going to help you maintain your milk supply. And this is a great tip for working moms who are away from the baby during daytime, but they are feeding in the nighttime. It will help them maintain their supply. Correct? Second thing is the hormones released in the night, in fact, have a calming effect on the mother and the mother's brain. So they can get away with less sleep as well as being, having these periodic wakenings. Another thing is, if you sleep with your baby in your bed or just beside you, your sleep cycles and the baby's sleep cycles actually start getting in sync. This is a research, what I'm saying, that the
Okay.
light sleep and the deep sleep, they start syncing. So when my baby goes into light sleep and starts moving a little, I will also wake up. I know my baby is woken. I'm also not fully awake. I just turn my baby towards me feed. So therefore, learning to feed in the lying down position is very important. So you both feed, you go back to sleep. If your partner is sleeping in the same room and in the morning, when you both get up, he will say, Arey, today the baby didn't wake up or what? I didn't hear, so they don't even realize that you have fed the baby 2 to 3 times in the night. So this is how the cycles are supposed to go. But if you keep your baby away from you, if you are, in that frame of mind that if I keep the baby away, I will get better sleep. In fact, our animal brain is always in a state of stress because that is natural for any mother. When the baby is away, we always keep worrying about the baby. And this is inherent. You don't have to think about it, right?
Correct.
So, first of all, we will not sleep well. Then secondly, the breast will get very, very engorged in the night. If you don't feed or you don't pump, and then there is no point if you are going to get up to pump anyways. It is better to just pick up the baby and breastfeed the baby, right? Much more easier. So these are the things that you need to consider. And about the bottle, one more thing I want to tell you that the earlier the bottle is introduced, higher are the chances of nipple confusion and also bottle preference, right? So we say that at least for the first 3 months, babies are not able to really distinguish between the two methods. And very often I get babies in the clinic who are breastfeeding very well, and the mother introduced one bottle at night, and then now the mother comes with the complaint, my baby is not latching. Okay. So
He flow from the bottle, right?
yes, because the bottle flow is fast, the nipple is small, the baby doesn't have to open the mouth wide. The technique or the method of suckling from the bottle and the breast is very, very different. So that confusion in the minds of the baby makes them choose the easier method, which is the bottle, and then they start rejecting the breast. So only until they grow quite old enough to distinguish between the two methods, it is not wise to introduce the bottle just for convenience.
Thanks. Very good insight. So, also we do keep getting this question that I'm going to deliver the baby soon. What all things I need to buy specifically for breastfeeding, whether it is breast pump or something else, mother keep asking, do I need to buy breast pads before even, knowing how the journey is going to be. So
Yeah.
what is your take on same?
Yeah, so even you get, clients with a whole list coming to you like, this is, my friends told me this is what you need. So
Yeah.
frankly, you don't need anything because nature is taking care of everything. Yeah, I mean, realistically speaking, while a woman is pregnant, her breasts are growing in size. The glands inside the breast are multiplying in number, in size. They are making the breast ready to produce milk to be able to feed that baby. So as the baby is growing, breasts are also preparing over the 9 months, correct? Now, in some cases, mothers feel very they feel a very stretchy sensation, heavy sensation. The bra starts becoming tight. So it is important that you change the bra, the cup size as per the growth. Don't wear very tight constricting bras because then there is a chance of forming a lump, where if the milk supply gets blocked, so you need such. So just see that you are buying the right sizes. Then completely front open shirts are the best dresses to buy because they enable full skin to skin contact. Okay. Avoid buying dresses which have very small, zips in the side, which restrict the access of the baby to the breast. So it should be front open things. Now, if you see, pillow is not compulsory. You can just simply use the pillows that are there in your house also. Idea of the pillow is what? That you don't have to bend. The baby comes to your level, right? So that is also okay. And if you want to buy a breastfeeding pillow, yes, you get a lot of pillows. So the horseshoe shaped one is which is called the boppy, is what most women do prefer. So you can use a pillow like that. You can buy that, take it to the hospital, when you go there for delivery. About a breast pump, I think, there are so many types of breast pumps available, and the cost also starting from somewhere from 2 to 3,000 rupees to 30, 40,000 rupees. So there is like this bigger range. So you need to consult somebody based on your history. Like, see, suppose you are a working mom and you tell me that I have to go back to work at 3 months. I will suggest you some other pump. If you are say that I'm not going to pump, I'm going to be with my baby and I'm going to be breastfeeding all the time, but once in a while I will go out, I need the pump. Then I will suggest you some other pump. Correct? So, which means that don't be in a hurry to just buy the next, best advertised pump kind of a thing. It is need based because all pumps are different, right? And
Oh,
other than this, nipple cream, nipple sheet, we don't need. If you are able to achieve a good latch, you are not going to get nipple soreness. So don't be in a hurry to buy everything, and everything is available easily. So we can just buy it as and when we need. Unnecessary no
okay.
point in holding everything at home which you may never use, right? Anything else I missed out, Charmi, if you remember?
No, 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 no. Yeah, I think you answered beautifully. So we have a question from our audience,
Hmm.
which says that how to eliminate feeding in the night, the best way to wean the child without affecting the child's emotional health.
Great. Okay. So, see, first of all, I would like to ask that mother, what is the age of the child? All right. Now, if we consider natural weaning of a child, like she said, we all believe in natural weaning. We don't want to do anything drastic and no cry it out methods because they have a huge psychological impact on the child. Correct. So now night weaning goes at different ages for different children. Right, depending
Mm.
upon, if I tell you general principles, a child, let us consider the natural weaning age for any baby. For human babies, natural weaning age, see, every mammal has different natural weaning ages, correct? So for a
Correct.
human baby, it is anywhere between 2 to 5 years, natural weaning age. When the
Okay.
baby natural, when we say natural weaning age, what do I mean? How do I define that? The baby no longer depends even emotionally, so nutritionally, emotionally, psychologically on the mother's milk or the mother's breast or the act of breastfeeding. So this can happen when the emotional needs and the nutritional needs of the baby are well met. Correct? Because the principle is this: needs which are met will go away in their own time, and needs which are not met, meaning that this baby has been deprived of feeding earlier on, or there were some problems, or there is something going on in the family, or the mother suddenly starts going to work, or anything that changes in the child's environment, the best comfort is where for the baby. It is at the
Hmm.
mother's breast, right? When they come here, they are like, okay, all my problems are okay, I can deal with them because I have a secure base, right? So when these things are provided, they naturally wean. But if after 2 years, like the child is already 2 years old and the mother is still breastfeeding, and then they suppose they come to me for advice, like how do I wean? So I usually would take a nutritional history and I think, okay, eating and everything, child is not nutritionally dependent, means on the breast milk because it still has a lot of calories. Correct? You are feeding the child other than everything properly. Then in the night, we can say that just ask someone else to, because they might be just getting up for thirst or for comfort, so try to give something to drink to the child, or like just sip of water, or make someone tap the child, or just sway a little, or just try to put to sleep by other methods, see if that works. If it doesn't work, yes, you have to feed the child. So point is this, that you have to recognize why the child is getting up in the night, fulfill that need, and then see if it was only for breast or breastfeeding or something else. So
Got it.
it's a little complex. It doesn't have one answer. It will be very much dependent on that mother and child, like how we will advise them to slowly wean off. But it will
Yeah.
has to be done gently and with love. Two main
Understood.
principles. No drastic measures.
Okay. So next question from one of the mother is,
Huh.
what should I do if baby is not latching on the nipple?
Okay. So if the baby is not latching, again depends on the age of the baby, but at whatever age, the best way to bring the baby back to the breast is always start with spending lot of skin to skin time with the baby. Do
Mm.
not force the baby to go to the breast because forcing only increases the aversion. Correct?
Okay.
So first and foremost, skin to skin. Why? Because it will then stimulate the natural feeding reflexes, which all babies have from birth, right? Something
Hmm.
has caused that aversion. So we need to just make them feel secure and calm on the body of the mother. We start with that first, right? Then, while we are doing that, someone has to find out why the baby is not latching also, isn't it? There are
Hmm.
two reasons. So take a history. When did the baby stop latching? Why did the baby stop latching? Was it because the mother's supply was so low that the baby was put to breast, baby didn't get anything, therefore the baby stopped latching? Or does the baby have any issues with the latching mechanism in the mouth? Examine that. So multiple things, right? But there are
Hmm.
always ways. Once we actually diagnose the cause, what is the cause, we can treat it. But always start with this, the skin to skin. Then we start with little bit of oral stimulation, something like finger feeding. So making the baby feed, suck on the finger, and at that time we introduce little bit of milk in the mouth. So the baby starts sucking on the finger, which is very much like the skin of the breast, right? And then when they are sucking on the finger, then we transfer them to the breast and see whether they are now sucking on the breast. So there are various methods. If the mother has a low supply, we need to add something else. So, like, that is the question that I would like to ask you, Charmi, about, low milk supply. This is the question that I get very often about role of diet in low milk supply. Can you highlight something about that?
Absolutely. So, what is most important is the mood of the mother. How good whether if she's in pain, her mood is going to be irritated. And
Mm.
if irritations continue, the milk supply dips. So whether
Yes.
you eat best of nutrition, it is not going to affect unless you are emotionally strong or your environment is emotionally strong.
Mm.
Second thing, being in India, I have come across a lot of myths and facts related to breastfeeding. There are a lot of different community has different myths and facts and different superfoods. But it is very important, which we all, during our programs, if you consider, whoever has joined our pregnancy program and postpartum programs, we have clearly told them, we give them the list of galactococcus food. Whether
Mm.
it is, dry coconut or fennel seeds or ajwain seeds, it's a galactococcus. And if few of the galactococcus are, introduced in their meals and in a proper way, it shows fantastic results in upping or you can say in milk production. But it's most important for the mothers to understand another thing which I always encounter. Mother is always worried about their weight. Already they must have put on 5 to 10 kgs to 12 max 15 kgs. And if they think, since our old tradition says that eat ghee ka laddu or eat this, ghee related stuff or jaggery related stuff, they feel that what if I put on weight and then how much time I'll take to recover to, shed that weight. So that is also one of the myth which is there. So I always tell, in place, when you are always confused or something, take a professional help. Get your, food plan designed in such a way that you are not overeating, plus you're feeding your baby, plus making sure that in case if your baby has different timings, you can say erratic timings, like in every baby's response is different. I have come across mothers who are taking or breastfeeding every 1.5 hour, or there are mothers who are feeding up to 1 hour, and then they feel, oh, my meal timing have got missed. It's okay if I can skip this. I will eat my next meal at this particular time. So all these gaps should be filled up. When these gaps are filled up, this helps to enhance the breast milk. Okay, and superfoods are very, very important. Whether you say Gonka Lattu, whether you say all the galactic, I'll name few galacticals, Satavari. Now, there is lot of misconception with Satavari over here is, whatever my doctor has given the Satavari, I want to try that. But when you see the ingredient list, it is all related to sugars. Okay,
Sugar. Yes.
yes, sugars. And
Mm.
mother love those Satavaris because they taste yum, and then they complain that we are gaining weight. So, and if you go for original Satavari, you will understand how bitter is. I myself have experienced like it is so bitter. When I know that now it's my Satavari time, I know the taste is going to be little different. So then I use other methods, which is also foods which are going to be like a galactic. So what I used to do, it's an example which I even tell my clients also, that you take satawari, you either add it to your milk in case if you're allowed to have milk, or water, whatever suits you. But post that, make a dry, mukhwas, or mouth freshener, which are also containing all the galactic foods, whether it is ajwain, fennel seed, dry coconut, in fact, dry dates, which are also known as kharek.
Mm.
Okay, they are also good source of galactose. So this way you would be able to complement, whatever you're eating, which are galactose, which is going to help you to feel better, and and overall your mood should be good. We do understand when you go through a birthing process, there will be a lot of pain. Maybe it is a C-section. So each mother, encounters different pain, aches, pains in the body. Sleep is disturbed. We do understand all this, but this does not lead to compromise in the meals options also. So this is what I always, tell all my clients. And when it comes to weight, we say it's absolutely okay. First, when you are happy, when baby is getting exclusive breastfeed, the byproduct will be your weight loss. But don't target weight loss first and then exclusive breastfeeding. So this is also what I want to
Yeah, that is a great message, Don't focus on the weight loss first, because again, the advantage of breastfeeding, the number of calories that are used up in producing breast milk, that helps
absolutely.
lose weight naturally, isn't
Hmm.
it? And
Yes.
one more point that you said, that about missing meals because the baby is feeding frequently and all. Yes, I
Yes.
encounter that. So there is this myth about, not munching while breastfeeding. You can't eat or drink. Nothing like that. There is no connection. The baby is well latched, baby is breastfeeding. You can keep sipping your whatever you want to sip, or munching your dry fruits or your dates or whatever. You can do that while breastfeeding also. I think it is more time efficient, isn't it? The snacking part can happen while breastfeeding as well.
Yes, yes, yes. So
And
another question over here is from our audience.
huh,
Hi, Manisha and Charmi. Hope we are doing well. So
huh.
great. Thank you for this. A client's baby is feeling very uncomfortable and releasing a lot of gas, and also have good bowel movements after every feed. So
Mm.
when this is happening, the baby is not able to sleep, isn't sleeping, and basically it becomes he's only comfortable sleeping in upright position. They have tried hing paste, gripe water, but not sure what is this causing, whether mother's food is leading to gas for the baby. So what is that? And second thing, mother is also experiencing a lot of sore nipples. So how
Okay.
do we address this?
So, Gauri, thank you for this detailed history. See, there are a lot of clues in your history which kind of
Yes.
give me a picture as to what is happening. Now, you said the mother is experiencing sore nipples. Sore nipples happen because of what? It is always because of a shallow latch. All right. Now, a baby who is latched shallow, to me, it means that the baby is not creating a tight seal on the breast. When I say seal means what? The baby's lips attached to the breast and it should form a vacuum there. No air can enter. But if a baby is latched shallow, or the baby is often leaving the breast, again attaching, leaving, again attaching, there is a lot of air that is getting sucked in. The baby is swallowing lot of air. Now, this air is what is making the baby gassy. Okay, that is number one reason. Second reason could be that the baby, because of the shallow latch or because of the timing at the mother's breast, is just managing to get what we call the fore milk. If you don't spend, so there are, I mean, for people who don't know about this, there are, when the mother starts breastfeeding, till she gets a letdown, the initial milk which comes is very high in sugar, which is lactose. Okay, and then when she gets a letdown, the fat starts coming into the milk, and then the fat quantity increases. So a baby who is only feeding for a less or a shorter amount of time on one breast manages to get lot of fore milk and very high lactose content. So a high lactose content gives rise to gassiness, and it also gives rise to green and frothy stools, which are frequent. So you have not mentioned the color of the stools, but you can ask that to the client, So frequent stooling with breastfeeding is absolutely normal. Getting watery stools is normal, but if the baby is getting pain constantly and gassiness, first thing, examine the latch. Okay. Many a times, we just tend to go on the diet directly and tell the mother you stop dairy and all of that without actually seeing the basic causes, physical causes. So unless we rule out all the physical causes, don't go into the diet directly. Okay. I hope that answers your question.
Yeah. So basically, I always feel that diet is not the primary cause for babies' gassiness. Okay, because mother's milk does not know what food the mother has taken. It is going to filter, and whatever is necessary for the baby, it is going to give that only. So this is very important, Gauri. You need to counsel your client in such a way that she tries to identify the problem and work accordingly. So next question over here is, how much rest does mother need to support milk production? So how much rest does she need?
So, see, Manish, I think Manish has asked this question. I think I did answer. I don't know whether you joined now or you were listening to me earlier. I did answer this question saying that, we cannot quantify the rest, but basically, the mother needs to, while breastfeeding, also needs to be in a relaxed position. So maybe after she latches the baby, she can lean back, a little. So that is called as laid back nursing, right? And just close her eyes and take rest. So while doing whatever her duties are towards her baby, she will have to find those pockets of rest. Correct? We cannot really quantify it. And I think there is one more follow up question also. The next question, which I was just reading about night sleep. Okay, because the baby keeps sucking the whole night, which disturbs my sleep cycle. So, see, a baby who is sucking the whole night is not normal. When I said that babies get up, they are supposed to get up for the feed, and then go back to sleep. So if the baby keeps sucking the whole night, we need to check things about your milk supply first. Okay, and it is a 6 month old. So a baby who is 6 months old, you should have already started solids. Charmi gives very beautiful plans for starting solids, and I really love them. So, after the baby is 6 months old, we need to, over and above breast milk, the baby needs solids also. So, as I said, I'll just repeat this again. Whenever there are night feeding issues, we have to take a detailed diet history as to how many calories the baby is actually getting, whether the baby is trying to compensate for those calories in the night. Okay. Then second thing is the baby away from the mother during the day? That is why baby is trying to compensate the bonding time with the mother in the night. So all these things are important. And of course, again, latching, milk transfer, because suppose you are feeding your baby, like 9 o'clock you fed your baby, you put the baby to sleep, baby got up at 11, again fed. But then after 11, again at 12, 12:31, again the baby is feeding. That means something is wrong with the milk transfer or the milk supply also. So it's very multifactorial, as you understand, it can't be one reason. We have to really investigate all these reasons.
But
Okay.
here the mother is specifying that how I can train my baby to sleep at a stress for 5 hours.
Sorry, yes, good point. So we cannot train the baby. I do not like the word train. Okay. The baby is a separate human being with very individual needs. And as I said, when their needs are met, the needs are going to go away. Right. So sleep training is something that, because the way it is described, no, it turns out to be a very rigid, regimented, like army ka training hota hai, that kind of a thing. No, we cannot enforce rules upon the baby. However, we can make conducive circumstances so that the baby learns to, regulate their sleep cycles properly. So when at night, first of all, as I told you, we eliminate the reasons why the baby is getting up so often. And then when the baby gets up also, you keep your lights dim. If you are like, it's best to be sleeping with the baby. So you just sleep and then put the baby to sleep. Least disturbance. You don't like cause the baby and everyone else around you to become awake. So there are tricks that you use so that the sleep of the baby and of yourself is least disturbed. Okay.
Okay, there is a question specifically for daddy. how a dad can support night feeding or take care of things for mother so that she can get rest and she can do best
So sweet.
for her breast.
Yeah, that's a sweet question. And I'm so glad that as a dad, you want to participate in taking care of the baby and, giving the mother rest. Very, very important. So, well, see, as far as feeding is concerned, if the mother and the baby are breastfeeding, then the mother will have to, take care of the feeding part. But maybe, the diaper changes or giving the mother what she needs while she's taking care of the breastfeeding, like if she's hungry, giving her something to eat, something to drink, giving her a pillow if her posture is not proper. So you can just support this whole act of breastfeeding and support the mother's needs while she supports the baby's needs. Okay. But if you were expecting an answer that if I was going to say that you can take part in the feeding, the answer is no. You can just be a support person for the feeding.
In short, making the environment as favorable for mother and the baby so that her mood is best. She's
Yes.
able to breastfeed exclusively. She's taking care for herself and baby is also happy. So
And
in
and
short,
praise the mother because she's really working hard. All mothers here, I want to tell you, every mother is trying to do the best that she want, that she can for her baby. And the partner needs to appreciate that, appreciate everything that she's doing.
I think this can be another pillar altogether. Like appreciation is the power of getting, best of hormones out.
Yes,
Right?
totally.
Yeah.
Okay.
So another question over here is there any particular technique to get a deep latch?
Okay, sure. So there are various techniques, but you need to know. So can I just pick up my model and show them
Yes,
directly?
yes,
Yes.
yes, yes.
So see, the goal, what is the goal of a good latch? The goal of a good latch is that baby should latch on the areola, maximum areola. This black part is called the areola. So maximum areola should be inside the baby's mouth. Baby's mouth should be wide open. And when the baby sucks, the mother should feel the suck here deep, not on the nipple. Because if the baby feeds on the nipple, mother is going to get pain and the baby is not going to get milk, right? So when latched, we call it an off-center latch. So off-center latch means what? That we don't expect the nipple to go here in the center of the baby's mouth. We expect the nipple to go up and touch the roof of the baby's mouth. And the baby's head is tilted back slightly so that the chin is touching the breast, the nose is away, both the lips are curled out, and it's a wide open latch. And last thing, important thing is the when the baby moves the mouth, it should not be like a fish mouth like that. It should be wide jaw movements and gulping should be seen and heard. So these are the signs of a good latch. Way to achieve it, various ways. So the way you hold the baby, since we are on that, let us do the holds also. So there are various ways to hold the baby while you are trying to attach the baby like this. So the commonly used hold for newborns is something called a cross cradle hold. Okay, which is this one. The second commonly used hold for newborns is a football hold, right? And when they grow slightly older, the next hold that we use is a cradle hold, right? And in all these positions, the mother can lay back. So this is called as laid back nursing because this helps gravity to keep the baby on the mother's body, right? So this way or this way. So laid back nursing is what we really recommend. There should be complete skin to skin contact between the mother and the baby. The baby should be turned completely towards the mother. And of course, the latch, it should be the way that I described. I hope that answers your question.
Yeah. We have very good question, and I'm so proud of this question. As a new father, I want to actively support my partner during breastfeeding and early parenting. Are there any counseling sessions, educational programs, or support group for fathers who can understand their role better? I think we should definitely do this session talk, upcoming session for specifically fathers, and we want all the male generation joining our session to get the best of knowledge and help their partner to make the environment so beautiful that the breastfeeding has zero complications or frustration for the mother.
Such a
What do you
wonderful idea. And, you are also aware that when we take our antenatal sessions, we make sure I tell them to try and get their partner on the session also. Okay, so it is, I see it very, like very classic difference when the partner has attended the session, the way that they bond with the baby, later, and the way he supports the breastfeeding later is something different only versus a partner who is completely clueless and is there, means he wants to support but he's not very actively involved. And the people who have done this, so that's a brilliant idea from the father. And I think, I'm not sure that there is such a support group right now, but we can create one. If given an opportunity, we can create one for the fathers that we are dealing with, isn't it?
Yes, absolutely. So one important question which I want to ask is how important for you it is a antenatal class for a mother to attend? Because how much you see that it will resolve the problem at the time of breastfeeding.
Yeah, so more than a mother, now that we saw this, parents to attend, isn't it? I want even the fathers to attend.
Yes.
And
Yes.
in fact, I want the grandmoms also to attend, because grandmoms also are very influential in, decision making process. Sometimes I see in families that they constantly keep giving advice to the new mother or the new father, or, parents, because obviously they have raised children and they are experienced, correct? But many times, some of this knowledge that is shared is not evidence based, correct? So which means that it is just because it is transmitted from generation to generation, but may not be always right. So when they attend the session, they realize, oh, this is something that I never did or I didn't know. So
Correct.
I feel, as a family, to attend an antenatal session, be it for childbirth, be it for breastfeeding, is very, very important, because all the things that we are discussing just now, no, I hope pregnant women are there also on our call today, because it is important for us to listen to these things while we are pregnant. It gets us thinking. Charmi, hi. Sorry, we lost you, I think, in between. Charmi, are you there?
Yeah, sorry, my internet is
Yeah, I
little.
guess so. Okay.
Yes.
So I was just
Yes.
saying that it is so important to start thinking about these things while you are pregnant, so that you can create your own support system around this. Correct? When I know what I'm expected to do, I can also figure out, okay, I will need help in this. I might need help in that. So I already start building my support system. The theme for this year's World Breastfeeding Week itself is to prioritize breastfeeding and create sustainable support systems. Means what? That you have to have knowledge, right? You should have thought about things. And I also see that there are some couples who come with a school of thought that feeding is something that is going to happen after delivery. Why bother now? I will think about it later, or I will deal with it as it comes, or the hospital staff will help me, the doctors will help me, the nurses will help me. And very often they feel disheartened when they don't get that help that they expected. So neither did they prepare themselves, and nor did they get help. They feel so completely lost and overwhelmed. So I don't want anyone to feel lost and overwhelmed. At least the basic knowledge everyone should have. And then if there are any problems, yes, we are there to help you, correct? But
Yes.
most mothers and babies are going to have a normal start to breastfeeding if you just know the basics. That is enough. Very few will come up with problems, and then there are people to solve them. So I would encourage everyone to take the session for understanding about breastfeeding antenatally only, before they actually give birth.
Absolutely. So, do you come across any nutrition related questions in your sessions?
Yes.
Any particulars which you want to highlight is very important for our audience to know?
Yeah. I have got a bunch of such questions which I wanted to ask you. So, one was about what is the meal that is easiest to digest during the postpartum phase, and why. So, being a nutritionist, now you will have to answer specific questions about food, what they should be eating, when, how, all of that.
Absolutely. So, postpartum is just a transition phase from pregnancy to, postpartum, where mother is actually having a baby with her and learning the different cues of the baby, right? So, I always tell my clients that actual pregnancy or actual challenges start when you deliver, right? So, one of the most important over here is food should be as simple as, which comforts the mother. It can be as simple as khichdi. Rice can be taken postpartum whether mother has undergone C-section or undergone a normal delivery. Rice will not cause any kind of infection in the sutures. To be very clear, in fact, it is a soothing food which has lot of dal, pulses, specifically moong dal, which is very easy to digest, and a lot of vegetable, and it is going to be creating a good emotional bond. If the mother is physically having comforting food, the bond with the baby is going to be strongest. So as simple as the khichdi with ghee is a comforting and the easiest food I can say which can be started postpartum.
Great. Okay. And there was a question. Shall I take a question from the audience now since we are in the
Yeah,
last
yeah,
minute? Yeah.
yeah,
So, how do you know your newborn is full and well fed? So, what are the signs? That's a great question. I think I missed out on telling you that. So, when a baby is at the breast, there are certain signs to tell us that the baby is now full and almost, ready to leave the breast. What are those signs? So while feeding, we have observed these, wide jaw movements and constant gulping by the baby. The breast starts feeling lighter as the baby is actually transferring milk. The breast will start feeling lighter. The baby's body starts relaxing on you. You can actually feel it, they just start going like this and their palms will relax and they start closing their eyes, and after some time the breast just like pops out of their mouth. Okay, so these are the signs that when all this is present, these are the signs that yes, the baby has had a good feed. We actually call it, in a funny way, we call it the drunken look. So it's like they just go like that floppy, so that is one sign. Then the baby being satisfied after the feed, remaining satisfied for at least an hour, hour and a half, 2 hours. So these are the subjective signs that you see. Objective signs also are there, like you have to measure the urine output of the baby. When I say measure, means count. Okay, so count the number of times the baby is passing urine. So after day 4, like after the colostrum phase is over and mature milk starts, after day 4 all babies should be passing urine at least 6 times in 24 hours. Okay, they usually pass more. If they are well breastfed, they will usually pass much more than that, but 6 is the minimum number. They should be passing at least 3 to 5 stools which are golden yellow in color with white seeds in them. This is typical breastfed baby stools and they are very liquidy. So don't confuse that with diarrhea. So number of stools and the amount of time the baby is passing urine. And third most important character is the weight gain of the baby. Okay. So again, after day 4, baby gains weight at the rate of 20 to 25 grams per day. So all babies have to cross their birth weight. So all babies, they lose weight a little in the first 3 to 4 days. Then they start regaining birth weight, regaining their weight back. It has to reach birth weight by day 10. Okay. So whatever is lost should come back. And after day 10, it has to start increasing at the rate of minimum of 20 to 25 grams per day. Okay. So now, of course, weight gain is something that you when you go to a clinic and you actually weigh on a digital scale in grams, then you will come to know. But urine and stool is something I want all the parents to keep a watch out for.
Okay, great. There's a question where it says any supplement that are best which can support breastfeeding, mother's recovery, energy levels, milk quality, which we both think they must compulsory, they should take it.
I would talk about the milk quality and then you talk about the recovery and energy levels. Okay.
Yeah.
So the quality of the milk is the topmost or the best for all mothers. Okay. There was a study done where they compared affluent mothers and mothers living on the streets and checked their breast milk. Same. Okay. So how is this? This is miraculous, isn't it? This is because breast milk is formed from the mother's blood, and it takes all the nutrients from the mother's body to make the best quality substance. However, if the mother is malnourished, she will suffer. Her bones, the milk will take calcium from her bones will become will become weak, okay, and porous, but the milk quality will not suffer. Iron stores in her body will start going down if she is not having adequate iron, but the milk will have enough iron. So point
Absolutely.
is, quality of the milk is maintained at the cost of the mother's health. So therefore, what should be done, Charmi?
So it should be always balanced meal. Any mother need to know that vitamins, minerals, carbohydrate, proteins, and fiber. If it is well balanced, the nutritional complications related to breastfeeding will be less. Now, say for example, as I said, khichdi is a comforting food. So what does khichdi has? The rice, which is carb, protein, which is dal. Again, add vegetables, so five vitamins and mineral. And on the top, you can just give a tadka of garlic. Garlic is known as galactagogues. So again, it is going to enhance the mother's breast milk. So very important. There is no need to give any supplement apart from shatavari, which is a superfood. I can say super and superfood for enhancing mother's breast milk. But again, shatavari from the original source, where the taste difference mother can make out. If that is supplemented with calcium-rich foods, now if I say what are the calcium-rich foods, amaranth, ragi, dairy products, in case if dairy is allowed, coconut, sesame seed, if it is well balanced, not to overdo, but whatever the need of the mother as per her requirement, if those are very well balanced, she can take care of the breastfeeding very well. Now, in terms of iron also, because it's very important that up to first 40 days mother is shedding the whatever she has collected in her uterus, which is basically known as lochia. Initially it is red in color, and by end of 40th day it may be the color changes, the color little fades. But basically, I do come across when mother says that I feel weak, I feel I have less of hemoglobin, I don't feel that energetic. So, there are different iron-rich foods which should be included in a plan, on a daily basis. Whether it is dates, halim seeds, which is also known as garden cress seeds. Just soak it, have it with vitamin C. Always remember, iron-rich food should be accompanied with vitamin C for the better absorption. So that is also very, very important. There are a lot of mothers who come, I am having iron tablets, still I don't feel great. But whether you're taking vitamin C or no, that is important. Absorption is also very much important. Okay,
Sure.
even ragi, having ragi porridge or ragi malt, that also helps to enhance the iron uptake. Whether mother is having a good amount of fruit, specifically, a pomegranate. Pomegranate is also going to help to enhance her iron intake. Whether she is including beetroot in the form of salad, it can be raw, it can be cooked, whatever she likes.
Mm.
But it should be well balanced meal. Well balanced meal is going to help to have proper nutrition, which is in which it's a cycle, I can say. The well balanced milk, mother is happy, milk is good, baby is happy, everything is in the cycle. So it should be in a balanced meal, I would say.
And what happens is, as doctors, we often tend to tell the mothers to continue their iron and calcium supplement, because in pregnancy it is started anyways, right?
Yeah.
The recommended daily allowance increases in pregnancy.
Mm.
So all mothers are put on iron and calcium. We tell them, you please continue that during lactation, because we are not sure of their nutrition. And if they do have a nutritionist in place who is guiding them and telling them what to eat, how much to eat to meet that daily allowance, then it's great. But from our side, if we don't know that, we just tell them, you continue your iron and calcium supplements and
Yes,
make
absolutely.
sure you are having enough protein in your diet, because a lot
Yes,
of
yes.
protein goes in the breast milk also.
Yes. So protein here, I will say that there are different sources: plant-based protein, milk products, dal, pulses. But again, there is one myth which comes. What if I get gas? What that will lead to some problem with my stitches or no? But there is a proper method. You need to soak it well. You need to cook it. So all these instructions are given by a proper nutritionist. So I always request mothers, please consult a professional take your professional help and go ahead with your plans. It is definitely going to be helpful. One last question which we can take is, can mother have onion, garlic, or sour foods like lemon during breastfeeding? Absolutely yes. There is no doubt that you need to avoid unless if there is some religious purpose included. But yes, if it is properly cooked, you can have, and in fact, garlic is one of the character core food which is going to enhance the breastfeeding.
And so the general message is that there is no natural home food which is restricted just because you are breastfeeding. Because there is no direct connection between your stomach and your breast. Okay, whatever you eat is going to be fully digested by your intestines, and it all the nutrients go into the blood, and breast milk is made from that blood. So if simple joke that we have, okay, the mother says, I ate ice cream and my baby caught a cold. Doesn't happen. Okay, that ice cream has no way of getting into your breast milk, right? So
Yes, absolutely.
so point is that don't worry, whatever you like, which is healthy, home cooked food, whatever among the foods that Charmi also described, please go ahead and have everything that you like.
Okay,
Absolutely.
guys. Thank you so much, Dr. Manisha and Charmi. We have reached the end of the hour. Uh, would you like to take one last question, or would you?
Is there any
We
question?
can. Yeah, we just got one more question, I think.
Okay, Charmi, can you take that?
Yeah, about
Yeah.
omega-3.
Yeah, just one follow-up question. Let's say, how about omega-3 for baby brain and spinal development? There are very good source of food, right? So why don't we try that? If we try, and if the meal plan is having an adequate amount of omega-3, you don't need to supplement it. But just make sure that mother is having it the right time and right quantity. That's important.
Something like flax seeds, we tell them.
Flax seeds, walnuts, yeah,
Yes.
chia seeds also.
Yeah, yeah.
And with that, thank you so much again, Dr. Manisha and Charmi. It was a very, very insightful session, and I'm sure our audience has a lot of takeaways today.